I don't think any country can boast of having enough doctors in any field. I mean, Ghana has an issue with the exodus of medical practitioners, and the countries that receive these medical practitioners will tell you that they still want more. So no one has enough. So that still tells us that there is a need for more practitioners, more specialists in every corner of the globe. So if there's a way to access them remotely without actually physically moving, traveling, not everywhere has such a safe transport system, there's a major plus to everyone in the world. And the monetary benefits are not just in terms of transport costs, but also in terms of time away from work for both the patient and the caregiver.
Currently, the way it works is you have doctors in Korle Bu in Accra. They have to get on a bus to travel to the north to do clinic days. It takes a week of their time. They're not able to see other patients. I'm from Seattle, Washington, and it's a very long ways away from Ghana. So we needed someone local on the ground that could have the technology expertise to be able to keep the system running. ECL turned out to be a perfect partner for that because they have the technology expertise to continue to use the system.
ECL always looks at making an impact with the society. So when we were contacted by Microsoft that they were running this 3D medicine tele solution, we jumped on to be able to help when it comes to the health sector, help the general populace get easier access to health people. So it was an exciting moment for ECL to be able to innovate with Microsoft to come up with a solution that would help a lot more people out there.
I've been building hardware under like a prototype level mentality for 20 odd years now, and hardware doesn't ever want to work. Software never wants to work the first time. So like, I'm glad that we had the capabilities of coming down and working heavily with the ECL team, heavily with the Korle Bu team. Arnold, Daniel have owned this project. They've taken responsibility for it. Ebenezer, when we need to get the M12 by 0.5 bolts that we needed for the van last May, he was able to come up with those. And I think it would have been impossible for us to do that without the people on the ground helping us hand in hand, taking ownership for the project.
One key thing to note about this whole project is that it has also allowed us as engineers with ECL, who have also received some international training on certain aspects of our work, validate more what we have learned, and it also has helped us to gain some sort of confidence when it comes to using the skills that we've acquired. And the idea of bouncing off knowledge with one another and then working hand in hand with them have also helped us to gain more knowledge and insight into the world of computer vision. And I think it's something that is very commendable.
I was not expecting sophisticated technology like this, because I saw that doctors interacted from other countries, which I was not expecting. So actually, I was surprised.
So one of the major advantages of this project is travel time and sitting and waiting. So imagine a client or a patient traveling all the way from the northern region in Ghana to either Kumasi or Accra to see a specialist, but rather going to a nearby local clinic or local center where we have a setup like this, and just sit in the rig with the 3D cameras and be able to talk to see, as well as the doctor examine the patient, not by feeling, but at least by seeing and observing, to make an initial assessment. Then you go on, do your investigations, and then finally come and see the doctor if it's time for your operation. On the converse, if you have had your operation and it needs a review, instead of traveling all the way to sit for the doctor for maybe 5, 10, 15 minutes, this can be done remotely, and not just in 2D, but in 3D and real time.
The way we see this helping patients is we're actually extending the coverage of specialized healthcare. In this case, we're working with reconstructive plastic surgeons, but we could see this being expanded to other medical specialties. But this allows the doctors who are in the major hospitals to see patients and determine if they're ready for care without having to travel and lose time when they could be seeing patients at their hospital.
Adia bako mani aje ho ne se enye nipa bako doctors ne dos na so obi a share no ideas nti no ema manage say doctors no e share ideas na se be hu ne obi a betimi ya no obi a de na dwen e bae nti ama ma hu say eno ye different na ma hu because normally no bako hospital no doctor bako be na bako ko hu na asem da na na be cancel but we no hu say obi a share na idea nti eno so betimi aboa ma o matimi enya your friend is saying akwanya obi wa akwanya foforo bi o de ka ho no beboa ama e bia o mutimi ya emba bi.
With this system, the doctors can stay in Accra and continue to see patients, but the van can travel and bring in additional patients so they get the care they need without taking so much time away from the doctors.
This project will improve patient care and patient consultation in that a lot of work goes into just moving around to meet your consultant, to meet the specialist who will be taking care of your problem. There's a lot of up and down and travel, time spent away from work, and time for caregivers to join you for the consultation. So if there's a way to shorten this process, if there's a way to bring the specialist to the community, irrespective of where the community is, then it's always a plus. So hopefully this project will shorten the transport times and cost of transportation for many, many people around the country and projectedly across the world to see specialists and consultants in different fields that can benefit from a 3D consultation.
Talking about the most challenging part in integrating this technology with the real world systems, you look at the various terrains in our various countries and you look at how this van is going to move to the various remote areas. You realize that we have very bad roads in this country, so moving to remote areas would quite be a challenge, and sometimes you have to also consider the terrain, whether it's a mountainous area, what kind of signal you are going to get in that area, what kind of humidity you are going to experience in that area, and also the time of the day that you are also running these tests. You realize that if you run at the peak of noon, you get a lot of sun in your van, and also you get a lot of heat, which affects the system some way, somehow.
The main issue with this innovation is access to internet. If you have internet, this can be done anywhere in the world or anywhere in the country. If we don't have internet, it will be a problem. So if we have some rural areas without any connectivity, that will be a challenge. And of course, you know that if you want satellite connectivity, that's going to be even more money and it will increase the cost.
Me hunu say new development anasa the full from member be hu ahan. And me hunu say a good idea. Say omo ye ne say be bo ko be call hospital be call salad. Ube card, ube say be juice kakura wi omo ntimi nsanye. Nti say bibi say ba na say betimi ato an kai me sure say betimi kura mu bu afra akwa akra ama akobo ankofo na say doctors no ha na omo say tena ho aka ni tu ya na beto a wo fia. I think say e idea so omo timi de ba mo a bebo nipa bebre.
The prototype that you see behind us, once it's working and we tighten all the screws to make it perfect, commercially there are multiple people who will jump on board to try and make this a success. Of course, the internet companies are always number one, as well as the camera companies, as well as so many other people who we do not want to mention just now. But the potential is so great that I'd say why not? It must definitely be a success.
We are super excited Microsoft chose ECL to be their trusted IT partner with this particular project.